Just yesterday, we've seen an increase in the numbers by over 100 new patients. And what that sadly means is our plans for Monday to reopen a number of businesses and places that we have committed to, those plans will be put on pause, because what we don't want to happen is we don't want this hospital to get overwhelmed with patients. I know the last thing that you all want to see is somebody walk up to that door and get turned away. And the last thing I want to happen is to put you in a situation where you can't help. So we're going to have to dial it back. We're going to have to dial it back because of what we see with the data. And we're going to have to dial it back because I want to make sure that if we have to help somebody, that we can help somebody. Well, what changed overnight, sadly, is we got 100 new cases. And when you look at the data, there has never really been a time where we've seen that level of a surge since March in our numbers. And it definitely shocked us and changed, our status. We are now in level orange and closely approaching red. We're going to be monitoring the numbers very closely over the weekend to determine how we move forward. And let me just tell you, it's a hard decision to have to make. And I was so happy about the zoo and about the museums, the hair and nail places, people who are struggling, parents who need their kids to be active in other locations. We were at a good place, and as painful as it is to put a pause on moving forward, especially as aggressively as I fought to move it up and to fight for the variance, and the state just approved the variance yesterday, we have to be responsible. And I think what it is it's a reminder to the public that we have to do better, because we all are a part of whether or not these numbers go up or come down, whether or not we open or sadly remain closed. We've gotten a little too comfortable. And the fact that we've seen over 100 cases overnight completely changes our plans for reopening, so we got to put a pause on it. We have to take a look at the data over the weekend, and we'll make a decision at that time. Right now, we want to allow what is open to continue, and our goal is to examine the data and then make a decision based on what we see over the weekend. When you said we got to look at the data to see, where this surge came from, and the contact tracing is going to help us kind of keep a bit control over it, but we all play a role in helping, and it's going to be important for us to all do our part. Let me tell you, this is probably the hardest thing that I have to do, because I am getting the phone calls and the emails from people who are very proud. They don't like coming to the government and asking for help. They want to take care of themselves. And unfortunately, they may not qualify for unemployment. They may not have any other source of income. They could barely pay their rent, and they could barely pay sometimes the expenses of where their business is. So this is hard. This is hard because we're talking about not just public health, we're talking about people's livelihood. Sadly, the economy is in a really bad place, and people are hurting. And so to have to make a decision like this, especially with hair salons, nail salons, places that can't do absolutely anything to generate money, is a very hard thing to do. So that's why it's so important that people remember we are living with COVID for some time. So we need people to do their part.